Hi everybody. Today we are talking about how caregiving impacts husbands and wives. Now it's no secret that caregiving impacts all of the relationships in our lives, but here's a few questions to consider. If you are a married couple, how are you preparing for all of the complexities of spousal caregiving that you may not even realize are eventually going to happen? If you're a married couple with two sets of aging parents, how are you considering or even preparing for the reality of taking care of two mothers and two fathers? Yes, I know it's a lot to think about, which is why this is the topic of this video. So if you're not yet in one of these situations, if you're single, considering getting married, or maybe you're just young and married and you're really healthy, I really do suggest starting to have conversations about what happens if one of us gets sick, what happens if we have to care for aging parents. And if you're already here and you're not talking about these issues that we're about to discuss, play this video for your spouse who may or may not want to talk about this. Play this video for both of you if you're a couple, to learn about all the things that might happen when you have to care for each other or you're caring for your aging parents or even your grandparents. I'm Pamela D Wilson. Please press the like button. Please press the share button below so that other people who are caregivers, potential caregivers, aging adults looking for hope, help, and support about caregiving and healthcare and aging and everything that goes in between can find these videos. There's also more support on my website. It's PamelaDWilson.com. I have a caregiver support group on Facebook. It's called the Caregiving Trap that you can request to join. So let me just start with a fun fact. Animals who mate for life: wolves, bald eagles, swans, and believe it or not, coyotes. So if you are a spousal caregiver, are you having discussions about what happens if one spouse becomes sick or dies before the other? And the reason that this is important is because you don't want to leave the spouse that you love in a mess. You also, if you have children, may or may not want to leave a mess for your children. When I was a care manager, and I've been in this industry for 20 years, I would have older adults come to me and they would say, well, Pamela, I want to do a care plan. I want to, plan for my aging and all that kind of stuff. And I would help them. But the one thing that they would always say to me is, well, my children will take care of us. They'll step up. I know they will. And my question to them was always, I don't know about that. Have you asked them? And guess what the answer was? The answer was, well, no, we haven't talked about it. We haven't asked our children. We just assume that they're going to show up. Well, that is a big assumption to make, especially in today's world where children may be living across the country or in another country. They may have their own children, careers, jobs, all of that. And the reason that parents don't think to ask is because they don't realize, and it is impossible to realize, honestly, unless you are a caregiver and you're in the situation. It's impossible to realize the time commitment and the stress involved and how being a caregiver just totally changes your life. It upends everything. It throws everything upside down. So when you can't realize what's going to happen, it's very hard to plan for it. So the other conversation to have if you're a married couple is, if you have aging parents, what happens when they need care? And more than likely you have two sets of parents. So is the husband going to take care of his parents? Is the wife going to take care of her parents? How is that going to affect your ability to earn money and your marriage and your children? So the question is, again, if you have aging parents, who is going to take care of them? So this is why conversations between adult children and parents should happen, because you both may be in couple situations. Now, there obviously are people who choose never to get married and stay independent. That's a different story. But you're looking at two married couple. So a younger married couple, older married couple. Now let's talk about spouses, right? Most spouses are close in age, but sometimes there are they're called age gap marriages, right? Where maybe your spouse is 10 years older than you, or 15 or maybe more years. So if you're in these age gap marriages, conversations about aging and getting sick and money and who's going to be the caregiver are even more important. Because let's say that you're the younger spouse and maybe there's a 15-year difference. The health between somebody who is 60 and 75 is vastly different, especially if you haven't been healthy all of your life and you have heart disease and diabetes and all of that. So a 60-year-old who's looking forward to retirement, who still may be working for another 5 years, has a 75-year-old spouse who's sick all the time, who needs care. Well, are you going to quit your job to take care of that person? Are you going to use your savings, your retirement, to have a caregiver come in and care for that person so that you can continue to work and earn income? And then the thing that we really don't consider is everybody dreams of retiring at 65, right? Well, 65, 75, 85, 95, how much longevity is there in your family? And do you have enough money to last you for 20 or 30 years? Most older adults don't. Because when you think about things and you look at things over the past couple of years, what happens is the cost of things keep going up and up and up and up. And for a lot of retired people, you're on a fixed income. Your income does not keep going up, but the expenses over here keep going up. So what happens if your expenses double and your income stays fixed? If you have retirement savings, you're going to be using more and more and more and more of that. And I will tell you, healthcare is expensive. It doesn't matter if you're on Medicare when you're older, because healthcare doesn't really pay for all those things that you think it's going to pay for. It doesn't pay for hiring in-home caregivers and extra time in a nursing home if you need it, and everything else that really relates to the daily things in life. And so let's kind of turn back talking about marriage and all the daily things in life, right? So relationships change over our lifetime, and even the things in our life and the events in our life change if we're spousal caregivers. So, you're early, young, you get married, you're on the go, maybe you're traveling a lot, you're working, you're doing this, then you have kids. That's a huge change for your life and your marriage. Then maybe in between there somewhere, your elderly parents need care, huge effect on marriage. And then your kids move out of the house and you're empty nesters, and then you're thinking of retiring, and then you've got more caregiving coming in because maybe you're caring for a spouse. And in the middle of all this, what happens if you're in a marriage and your spouse, younger or older, comes down with some health condition and they become disabled and they can't work anymore? And so your lifestyle is based on two incomes, right? But now you have a spouse that can't work, and you are the spouse who's working and taking care of everything. But it's hard to have those conversations with your sick spouse to say, hey, you know what? We can't afford this house anymore. We can't afford to go on vacation. We can't do all of this because our income has been cut by 50%. So now we got to make a lot of changes that we never thought we would have to do because we dreamed of this wonderful retirement that now probably, honestly, is off the table. So when health changes, this really can become a financial drain on the family. It can be a financial drain on a marriage. A lot of additional stress and struggle. And then there's all this emotional stuff going on, right? You're married, you're worried about your spouse, you're worried about paying the bills, maybe you got kids. All of this emotional turmoil results in health issues for the caregivers. Caregivers actually get more sick than the person they care for, and especially women. So there are statistics from health insurance companies that point to the fact that if you have a chronic disease, and let's say you've got high blood pressure, and you are a woman, and over here you're high blood pressure and you have a man. If you add emotional stress on that, so mental health issues, depression, anxiety, the women actually become more sick than the men. And we don't know why this is, right? Do we think that men just don't deal with problems? the same as women. Most of them are less emotional. They're more factual, right? But they also don't like to go to the doctor until they're really sick. And women tend to, because of, all kinds of women things, right? We go to the doctor more. So this means that if you are a female spousal caregiver, it is even more important for you to take care of your health so that when you become that caregiver, which the statistics show you will, you do not become sicker than the spouse that you are caring for. Now, let's throw in younger marriages and aging parents. Same things apply. It's easy to get burned out and neglect your health, and it's also easy to focus so much on caring for your parent that you forget that you have a spouse, and you forget that you have a children, and you forget that you have a house, and you forget all this kind of stuff. In my caregiver support groups, I talk to a lot of spouses, and I would say more men than women, right? Because women become the caregivers. There's a lot of husbands out there who are saying, man, my wife I never see her anymore. She's with her parents, taking care of her parents, and I feel like I'm, taking care of the kids myself and managing the house myself and all of that. And how do we balance this? Well, this video, right? I mean, if you got to start the conversation and you don't know how to start it, show this video to your spouse who is that caregiver who you may be very concerned about because they are running themselves ragged between work and caring for the parents and doing all this kind of stuff. You're watching your spouse that you love, their health decline, them becoming very stressful. And you, as that spouse, are getting very resentful and angry. These are conversations that you have to have. So let's kind of just go through that list that I ran through, right? So challenges for spousal caregiving and married couples caring for aging parents. Money. How do you pay the bills? How do you pay caregivers? How do you maintain a standard of living when your parents' income is capped and the expenses keep going up? What if you live another 20 or 30 years? What is your plan? How are you going to pay those bills? You have to think about that when you're younger and healthy and you're working and you have the ability to save money for your care when you're older. Medicare does not pay for everything, and that is a huge shock for people. Then there's the more realistic worries, right? When you become a caregiver, it can last for years. So 5 years, 10 years, 15 years, 20 years. And this is an honest worry, right? You worry about how long this person that you love and you care for is going to live, especially if you're a caregiver in a high-need situation. If you're taking care of somebody with Alzheimer's or dementia, that can go on for years. And a lot of caregivers feel guilty about thinking this way, but it's hard. Caregiving is a job. It wears on you. And what isn't often discussed is the fact that the person who is sick, they don't feel good. If they have dementia, they have cognitive issues up here. They can't remember things. They may say things that are offensive. They may have behaviors in the afternoon. They may sundown. And if you don't feel well, sometimes you're just not a nice person. And it's hard to manage and understand that when you're this sick person. It's hard to be appreciative of this person who's waiting on you hand and foot and doing all these things. So then what happens is the caregiver, the person who's doing everything, gets resentful, and honestly, they wish their spouse was dead. So that is why talking about these things before they happen is so important. Do you want to be that burden on your spouse? If you don't, you need a plan today to save money to pay for care and all of those things. Now, it may already be too late for that. You may be in this situation where you're like, oh my gosh, this is horrible and I can't do this anymore and I hate my spouse because this caregiving is ruining our marriage and we were going to have this retirement and we don't have this and I can't go see my kids and I haven't seen my friends. And yes, it's a nightmare. It's hard. Then you throw in the healthcare system, right? Managing all these health problems with doctors that you don't trust. You're dealing with health insurance companies who don't want to pay the bills because they have coding issues. I mean, this is a really hard situation. And then, honestly, women have a harder time getting doctors to pay attention to them, unless you have a female doctor, because there's this perception that women make up health issues. Well, it's not that. The fact is that men who are sick don't want to go to the doctor, and they delay so long that by the time they do go to the doctor, it's really something serious. So women to the healthcare system are seen as complainers and whiners, while men are taken more seriously. There are actually statistics on this. There are studies on this. All those clinical studies out there for medications, they're mostly done on men. They're not done on women. Women are different. Women have different health issues. We have different lives. So back to the caregiving problems. Let's say you're caring for a spouse and you're doing okay, but they have physical needs. So you're a 110-pound woman and your husband is 6'5" and he weighs 250 pounds. How are you going to move him about if he cannot move? Are you going to be able to get him out of bed and put him in a wheelchair? Are you going to be able to shower him? There are these situations that kind of go beyond what's reasonable. And again, this is another thing to talk about before you get into these situations. Because I know married couples where the woman's doing everything and she has this husband that she cannot care for. And the husband refuses to move to a care community. Now you might be thinking, well, Pamela, there's no money. Well, if there is no money, then you look at Medicaid and Medi-Cal and the federal programs to pay for care so that as that spouse, you're not honestly killing yourself taking care of a spouse. And let's go back to married couples. You're not that adult child who's in a marriage caring for your parents, and you're not killing yourself. Caregiving it's a long road, and I don't want to make it sound like it's not rewarding, because it can be rewarding, right? You can feel really good about taking care of another person. It can improve your relationship. You can learn a lot of new skills that you never thought you could do before, like bathing your parents and changing Depends and all that kind of stuff, right? So there's a lot of good stuff. But stress cannot be ignored. And marriages last a long time, and there's a lot of changes. So the quality of your relationship when you're married also depends on how good of a caregiver you'll be. Now, interestingly enough, the quality of your relationship as a child with your parents also dictates whether you are going to show up to care for them when they're older. So if you have children, think about that. Remember that old joke that says my children are going to pick my nursing home or something? Well, it could be true. Then you have all these legal things that people don't think about. So medical power of attorney, financial power of attorney, living wills, how much care do you want if you truly become sick? Do you want feeding tubes? Do you want to be intubated? Do you want to be kept on life support? Those are conversations to have long before any of this comes up. And again, go back to the fact of not assuming that your children are going to take care of you if you're a married couple. And even, and I don't want to say this, but not assume that your spouse is going to care for you. They will. But look at the degree to which you want your spouse to give up everything to care for you. That is not a conversation that hardly any couples have. And if you really love your spouse, you're going to want them to be able to go on after you pass away. How are they going to survive financially? What's their health going to be like if they ruin their health caring for you? Very hard discussions, very realistic discussions. And a lot of people who are not caregivers will say, well, Pamela, that's the vow that you make in marriage. Yes, it is the vow that you make in marriage, but you have no idea what's going to happen 20, 30, 40, 50 years from now and how difficult it's going to be. So for those of you who are married and you are not caregivers, do not look down at caregivers, because one day you will be one and you will know what it's like. So I'm Pamela D Wilson. My website's PamelaDWilson.com. Again, please click the share button, click the like button on this video, share it with people you know who are looking for hope, help, and support. Go to my website. There is an online caregiving program there. It is called Caring for Aging Parents. My podcast, The Caring Generation, has over 160 episodes. Caregiving group on Facebook. It's called The Caregiving Trap. There's a lot of support on my website. There's also over 800 videos here on my YouTube channel. So in that little search bar at the top, just put in a subject like spousal caregiving or managing chronic disease or Medicare or Medicaid or how to pay for care for aging parents. Hundreds of videos will show up. Thanks for being here. Have a fabulous day today. I'll see you all again soon in another video.